Hi, it's Christina with Cemetery of Choice. Today's August 10th, and I am going to guess that if you were asked to describe a dead person, you would not choose the words alert and responsive, but you might if you worked at an abortion clinic, and we're going to get to that. But our first anniversary today was from the illegal days. It was in 1917. 29-year-old Amelia died at Chicago's St. Mary's Hospital from a criminal abortion that was attributed to a Dr. Anna Sorensen. Now, Sorensen was indicted by a grand jury on September 1st, but remained free to be implicated in fatal abortion in November and another one in January of the following year. Now, Sorensen was finally arrested on January 15th, and her killing spree came to an end when she herself died in prison while awaiting trial. So, thank God for small favors. But let's go ahead and jump into the safe and legal days. Now, the Center for Reproductive and Sexual Health, aka CRASH, okay, was the very model of a modern major clinic. That doesn't work. It's a model abortion clinic. A published review of their earliest patient records from Bernard Nathanson played a role in proving the safety of legal outpatient abortion. Real safe. On August 10th, 1988, a woman identified in the medical board documents as KB was given anesthesia for a safe, legal 14-week abortion. Now, Life Dynamics on their Blackman wall of women who died from legal abortions, they call her Kelly. So to be consistent across sources, I'm going to call her Kelly too. Now, shortly after the procedure started, Kelly was showing signs of distress, a pale complexion, weak pulse, dilated pupils, darkened blood. Now, she started showing these signs by around 12:15 or 12:30. The records are really unclear. That's a 15-minute span where this young woman was under medical supervision, and they had no documentation what condition she was in. She was transported to Cabrini Medical Center, where she was pronounced dead from complications of anesthesia. Now, after Kelly's death, the health department investigated and they found a mystery. Kelly's chart listed her postoperative condition as pink, responsive, alert, even though she was in full cardiorespiratory arrest at that time. In other words, she was dead. She had not been officially pronounced yet because people were going to come along and try to revive her. Why was this dead patient charted as pink, alert, responsive? Because her postoperative notes had been written before the abortion was even started. So, yeah, we're supposed to look at this clinic's record of their complication rate that they take from their records for how many patients have complications, and that's going to tell us the complication rate. Yeah, she's pink, alert, and responsive, even though she's dead. Now, the inspectors also noticed some other things. They noticed that CRASH did not employ any proper monitoring equipment or procedures. They had no working EKG machine. They didn't have a cardiac defibrillator. So, yeah, Kelly was pretty much dead because there wasn't much they could do to revive her. Nobody on staff was qualified to perform CPR. Imagine that. And you can't go into an elementary school. You can't go into a kindergarten. You can't go into a daycare center without there being people who are qualified to perform CPR. This was the largest freestanding abortion clinic in the Western Hemisphere, and nobody on the premises was qualified to perform CPR when this patient stopped breathing. And why did she stop breathing? Well, anesthesia was administered by eye with no means of accurately measuring the dose. They just kind of watched it drip in. They estimated that the doses patients were getting was twice that recommended in the procedures manual. The operating rooms were ill lit. There was no soap or paper towels at the scrub sink. The walls and floors were dirty. Trash was stored in the scrub room. There were makeup stains on the oxygen masks and nitrous oxide masks, dusty tubing on the suction machines, and blood on the wheels of the operating table. Oops. Now, Crash had no documentation verifying the credentials or qualifications of their medical director, David Gluck. That's this character. He had previously been convicted of felony charges related to selling narcotics to pay off his gambling debts. His license had actually been revoked 2 months before Kelly's death, but had been restored by judicial stay. And there was no evidence at the time of the investigation, 2 weeks after Kelly's death, that Gluck had reviewed her chart or the charts of 18 other patients identified as having suffered complications. Although how they managed to identify them as suffering complications, I don't know, because they're doing their post-op reports before they even climb on the table. Now, the state closed Crash for 60 days as an emergency closure, but they never reopened. Somebody else hired this character, and in 1994, he performed the fatal abortion on another woman. So, this is the newest article I found about it. And when the Cemetery of Choice is back up and running, you can find more documents there about this death.